Social workers are an important part of the holistic nature of hospice care. I don't think you can do hospice care without social workers. They're just as important as the nurses, the doctors, the CNAs, chaplains, volunteers, the whole team.
Social workers they're the glue that binds everything together. We're the people that take all of the different services somebody might be using at one point in time and kind of coordinate them into one holistic approach to caring for them.
The most memorable time was when a family member said to me, "Thank you so much, you made our journey so much easier. We understood that my father was dying. We understood what to expect next, and you and the staff here made our experience much easier."
My most memorable experience at UNT is coordinating a dentist to provide in-home care for a patient who was bedbound and being able to see the look on her face when she received her new dentures.
One of my patients at an assisted living was very close to passing away, and no family was able to be there, and our nurses were kind of far away, so they asked me to go. And I was sitting there in the room with her for quite a while, and it was very quiet, and so I just kind of started to sing to break the silence. And I don't have much of a voice, but maybe about 10 minutes into it, the nurse arrived, and I said, "It's been a while since she's taken a breath," and she listened to her heart, and she said, I think she's passed away. And so that's how that patient passed away, and nobody was able to be there but me, and I think the family sure was appreciative that someone was able to be there, and I think that's just one of those things that'll kind of stick with me as I move about in my career.
As part of the team, the social worker, the bereavement counselor is an important part, and I think that's what I really enjoyed about my role. I always felt as a social worker when I went into a home with my nurse that there wasn't anything we couldn't do together. Going in by myself, there were going to be things I couldn't answer, things I couldn't do, but when I went in with my team member, I always felt that there wasn't anything we couldn't do for that patient and family.
It's just such a privilege to see the compassion and the abilities that come from families and from relationships, and what people are able to do for each other when times get tough, and in some really difficult emotional times, some really beautiful things can come that we get to be a part of and get to witness. And I that is definitely my favorite part of working as a social worker with Unity.
Social workers are amazing.